The increase in the number of cases continues, and that is what we're watching every day. They see it as an upward trajectory. I see it as a wave that will break at one point, and the question is, what is the point of the break? And when the wave breaks, does it crash over the healthcare system, right? That's what we've been talking about. So two tracks simultaneously. You have to reduce the spread of the rate of the virus, the rate of spread of the virus. You're not really going to control the spread, but you can reduce the rate of the spread so you can handle it in your hospital system. That's what every state is doing. That's what this is all about. How do you reduce the rate of spread? Reduce the density, do more testing, isolate the people who test positive. Second track, increase hospital capacity as quickly as you can so that at the apex of the wave, you have the hospital capacity for the people who will need the hospital capacity, which are the vulnerable people that we have been talking about. Reducing the spread, density control. We've taken every action that government can take. Closed gyms, theaters, other high-density businesses, non-essential employees, social distancing. Matilda's Law, remember, this is about protecting vulnerable people, older people, senior citizens, compromised immune, underlying illness. Those are the people who are vulnerable here. That's the focus of all of this. The greatest density control issue right now is in New York City. I saw the issue myself. I told New York City I want to plan. Yesterday I said I want to plan on how they're going to control and reduce the density. I want the plan today. I want the state to be able to approve the plan. It has to focus on young people and the gathering of young people. I've said it before. You can get it. The numbers show you can get it if you're a young person, and you can transmit it. It's reckless. And it's violative of your civic spirit and duty as a citizen, as far as I'm concerned. If New York City needs legislation to enact their plan once we approve it, I would ask New York City to pass that legislation quickly. If they have a problem passing legislation, they should let me know. Also, on reducing the spread, increase the testing capacity. When you identify somebody positive, isolate that person. What we've done on testing is important. March 13th is when the state got the authority to start testing, right? Up until then, the federal government was controlling all the testing, and it was going through that bottleneck of a federal government. I don't mean that in a pejorative way, but it had to go through the FDA, the CDC. I said decentralize that task. Let the states do it. March 13th, the FDA allowed the state to start testing. In 10 days, we have gone from testing 1,000 people per day to 16,000 people per day. Well, how much is that? That's more than any other state in the United States is testing. That's more per capita than South Korea, which was the gold standard of testing. They were doing 20,000 per day on a much larger population, about double the population of New York. So we're doing 16,000, which compared to China, South Korea, per capita is even higher. So in short, we're doing more testing than anyone. 2 points off that. Kudos to the team that put that testing in place and the nurses and the doctors. God bless them for being out there every day and doing it. But also, our numbers will be higher on positives because we're doing more tests. We have multiple locations working now, and we'll be increasing those locations. Second track, increase hospital capacity, increase the number of beds. We have 53,000. We may need 110. We have 3,000 ICU beds. We may need between 18 to 37,000. That's my greatest concern because that's where we need ventilators to turn those ICU beds into beds for people suffering from the virus. We are today issuing an emergency order that says to all hospitals, you must increase your capacity by 50%. You must. Mandatory directive from the state. Find more beds, use more rooms. You must increase your capacity 50%. We would ask you to try to increase your capacity 100%. Okay? So we now have 53,000 beds. We need 110,000 beds. If they increased the capacity 100%, that solves the mathematical projection, right? I think it's unreasonable to say to every hospital, basically double your capacity. I don't think it's unreasonable to say try to reach 100% increase, but you must reach a 50% increase. 50% increase, we're only at 75,000 beds. We still have a problem between 75,000 and 110. Once you secure the bed, you have to secure the staff. You are going to have staff that are getting sick and need to be replaced. You create these new beds. You don't have the staff for those new beds now. They just don't exist. Your staffing is to your number of beds. You increase the number of beds, you need more staff. We are going to the entire retired community, healthcare professionals, and who are licensed, registered, and we're saying we want you to enlist to help. It's not a mandatory directive. I can't legally, well, I probably could legally ask them to come into state service, but this is just a request. We've put it out. We've gotten very good response. There are hundreds of thousands of healthcare professionals who are licensed or registered in this state, but we have 30,000 responses to date. And I'm doing an emergency order, executive order for all nurses who are registered to enlist. And the Department of Financial Services is sending a directive to insurance companies. Health insurance companies employ many nurses, doctors, etc., in the insurance business. We're saying to the insurance companies, we don't need them in the insurance business now. We would like them to help in hospitals, because this is not about assessing insurance claims at this point. This is about saving lives. When we get to assessing insurance claims, we can handle it then. Supplies are the ongoing challenge nationwide. Masks, PPE, ventilators are the number one precious commodity. This is happening on an ad hoc basis. We are competing with other states, as I have said. We have made certain strides. We have a full team working on it. We're very aggressive. We're talking to other countries around the world. We're talking to companies. We have New York manufacturers who are really stepping up to the plate and converting factories, etc. But this is not the way to do it. This is ad hoc. I'm competing with other states. I'm bidding up other states on the prices. Because you have manufacturers who sit there and California offers them $4, and they say, well, California offered $4, I offer $5, another state calls in and offers $6. It's not the way to do it. I was speaking to Governor J.B. Pritzker yesterday about this. Why are we competing? Let the federal government put in place the Federal Defense Production Act. It does not nationalize any industry. All it does is say to a factory, you must produce this quantity. That's all it does. I understand the voluntary public-private sector partnership, and there are a lot of good companies who are coming forward and saying, let us help. But it can't just be, hey, who wants to help, let me know. We need to know what the numbers of what we need produced and who is going to produce that and when. I get that a lot of companies are stepping up and doing good things, and that's a beautiful thing. They're doing it here in New York, too. But you can't run this operation that way. It can't just be based on we're waiting for people to come forward with offers. And if you happen to get a lot of offers on gloves, then you have a lot of gloves. But if you get no offers on masks, then you don't have masks. The Federal Defense Production Act just says you can tell a company, manufacture this many by this date. Yes, it is an assertion of government power on private sector companies. Yes. But so what? This is a national emergency. And you're paying the private sector company. They're going to produce a good, and they're going to get paid. And by the way, they're going to get paid handsomely. You cannot continue to do these supplies on an ad hoc basis. We have had success securing supplies. We're going to be dispatching them across the state today. These are the number of goods that are going out. You've heard on the news that, especially in New York City, they're worried about running out of supplies. Again, this won't get us through the entire situation, but this is a significant amount of supplies that will be going out. New York City, for example, 430,000 surgical masks, 176,000 pairs of gloves, 72,000 gowns, 98,000 face shields, 169,000 N95 masks, which are very precious now. They're about $7 a mask. So these are significant supplies. We have been having some success in gathering them, and we're distributing them, and this should make a difference. Well, it will make a difference. Again, not until the end of the crisis, but short term. Hospital capacity. I'm on my way down to the Javits Center today. I want to make sure those hospitals are getting up right away. Then we're going to use Stony Brook. We're going to use Westchester. We're going to use Old Westbury. President Trump did deliver yesterday. I put forth a series of requests in the morning. He did the briefing in the afternoon, and he responded to those requests. That's government working. That's government working quickly, and I thank him for it. It makes a big difference to New York. We're getting those emergency hospitals, the Javits hospitals, for example. Those are 1,000 beds right there with the equipment, with the ventilators, and with the staffing. So that's a big deal. The president declared what's called a major disaster declaration. That allows FEMA, Federal Emergency Management Agency, to help us. There's normally a 75-25 split between the cost of those services. The federal government pays 75, the state pays 25. I said to the president, I can't pay the 25. We just don't have those kinds of resources. The federal government has the authority to waive that 25, so the federal government pays all 100%, and that's what the president is doing, and I appreciate that. I also asked for the FDA to expedite the approval of an experimental drug that we are working on here in the state of New York, which I'll tell you more about in a moment. And the president also did that. The FDA gave the New York State Department of Health approval to use on a compassionate care basis a drug that we think has real possibility. On the drug therapy, Tuesday we're going to start the hydroxychloroquine with the Zithromax. That's the drug combination that the president has been talking about. The FDA approved New York State Department of Health to proceed with an experimental drug, again on a compassionate care basis. But what it does is it takes the plasma from a person who has been infected with the virus, processes the plasma, and injects the antibodies into a person who is sick. And there have been tests that show when a person is injected with the antibodies, that then stimulates and promotes their immune system against that disease. It's only a trial. It's a trial for people who are in serious condition. But the New York State Department of Health has been working on this with some of New York's best healthcare agencies, and we think it shows promise, and we're going to be starting that this week. There's also work on a serological drug where you test the antibodies of a person and see if they had the virus already. We all believe thousands and thousands of people have had the virus and self-resolved. If you knew that, you would know who is now immune to the virus and who you could send back to work, etc. So we're also working on that. The numbers today, total tested up to 78,000. Tested overnight, 24-hour period, 16,000. As of yesterday, about 25% of all the testing nationwide is being produced right here. Number of positive cases, we are up to 20,000 statewide, 5,000 new cases, which is obviously a significant increase. And as I say, that trajectory is going up. The wave is still going up, and we have a lot of work to do to get that rate down and get the hospital capacity up. You see it spreading across the state, this way it's spread across the nation, and that will continue, my guess is, every day. We have right now on hospitalizations, 13% are being hospitalized. None of these numbers are good, but relatively, that is a good number. Remember, it's the rate of hospitalizations and the rate of people needing ICU beds. 13% is down. It has gone as high as 20%, 21%, hovered around 18%, 17%, 13% is a good number. Of that number, 24% require the ICU beds. The ICU beds are very important because those are the ventilators. Most impacted states, you can see that New York far and away has the bulk of the problem, and that's relevant for the federal government. That's relevant for the congressional delegation that is arguing for federal funds. Fund the need. Fund the need. New York, we have 20,000 cases. New Jersey, 1,900. California, 1,800. So proportionately, in absolute terms, New York has by far the greatest need in the nation. Again, to keep this all in perspective, Johns Hopkins has studied every case from the beginning, 349,000 cases. Death toll worldwide is 15,000, right? Many will get infected, but few will actually pass away from this disease. Also, this is all evolving, and this is all evolutionary, and we are still figuring it out. There has to be a balance or parallel tracks that we're going down. We're talking about public health, we're talking about isolation, we're talking about protecting lives. There also has to be a parallel track that talks about economic viability. I take total responsibility for shutting off the economy in terms of essential workers. But we also have to start to plan the pivot back to economic functionality, right? You can't stop the economy forever. So we have to start to think about, does everyone stay out of work? Should young people go back to work sooner? Can we test for those who had the virus, resolved, and are now immune? And can they start to go back to work? There's a theory of risk stratification that Dr. Katz, who's at Yale University, is working on, which is actually very interesting to me, which says isolate people, but really isolate the vulnerable people. Don't isolate everyone, because most people are not vulnerable to it. And if you isolate all people, you may be actually exposing the more vulnerable people by bringing in a person who is healthier and stronger and who may have been exposed to the virus, right? Can you get to a point where the healthy, the people who are most likely not going to be affected, can go to work. Remember, you study the numbers across the countries that have been infected. The survival rate for those who have been infected is like 98%, right? A lot of people get it. Very few people die from it. So how do we start to calculate that in? We implemented New York pause, which stopped all the essential workers, etc. We have to start to think about New York forward. And Steve Cohen and Bill Mulrow, who I've worked with for 30 years and now in the private sector, they're going to start to think about this. How do you restart or transition to a restart of the economy? And how do you dovetail that with a public health strategy? As you're identifying people who have had the virus and have resolved, can they start to go back to work? Can younger people start to go back to work because they're much more tolerant to the effect of the virus? So how do you turned off the engine quickly? How do you now start or begin to restart or plan the restart of that economic engine? Separate task, but something that we have to focus on. I offered my personal opinion yesterday. I separate my personal opinion from the facts. You can disregard my personal opinion. You can disregard facts, but they are still facts. I said, don't be reactive, be productive, be proactive. Few people have said to me afterwards, well, what did that mean? Happens to me often. Look, this can go on for several months, okay? Nobody can tell you, is it 4 months, 6 months, 8 months, 9 months? But it is several months. We all have to now confront that is a new reality. That is not going to change. You're not going to turn on the news tomorrow morning and they're going to say, surprise, surprise, this is all now resolved in 2 weeks. That is not going to happen. So deal with this reality. Understand the negative effects of this, which I've spoken to personally because these are personally negative effects. You don't feel them governmentally. You feel them personally. You feel them in your own life. And don't underestimate the emotional trauma and don't underestimate the pain of isolation. It is real. This is not the human condition. Not to be comforted, not to be close, to be afraid and you can't hug someone. Billy and Steve walked in today. I hadn't seen them in months. I can't shake their hands. I can't hug them. You know, this is all unnatural. My daughter came up. I can't even really give her the embrace and the kiss that I want to give her. This is all unnatural and disorienting. And it's not you. It is everyone. It's the condition. And we are going to have time. And the question is, how do we use this time positively? Also, at the same time, we have to learn from this experience because we were not ready to deal with this. And other situations will happen. Other situations will happen. And let's at least learn from this to be prepared for the next situation, as dramatic as this one has been. Also, finding the silver lining, the positive. Life is going to be quieter for a matter of months. Everything will function. Life will function. Everything will normal operations. There won't be chaos. The stores will have groceries. Gas stations will have gasoline. There's no reason for extraordinary anxiety. But it is going to change. You won't be at work. You can't be sitting in restaurants. You're not going to be going to birthday parties. You don't have to go to business conferences on the weekends. there's less noise. You know what? That can be a good thing in some ways. You have more time. You have more flexibility. You can do some of those things that you haven't done, that you kept saying, I'd love to be able to. I'd love to be able to. Well, now you can. You have more time with family. And yes, I get family in cramped quarters can be difficult. But it's also the most precious commodity. For myself, this young lady, Cara, is with me. She would never be here otherwise. You know, I'm dad, right? The last thing you want to be when you're in Cara's position is hang out with the old man and hang out with dad and hear bad dad jokes, you know. They'll come for the holidays. They'll come when I give them heavy guilt. But I'm now going to be with Cara literally for a few months. What a beautiful gift that is, right? I would have never had that chance. And that is precious. And then after this is over, she's gone. She's flown the nest. You know, she's going to go do her thing. But this crazy situation, as crazy as it is, gave me this beautiful gift. So one door closes, another door opens. Think about that. And as I said, normal operations will continue. As I've said from day one, the level of anxiety was not connected to the facts. There is no chaos. The net effect, many people will get the virus, but few will be truly endangered. Hold both of those facts in your hands. Many will get it. Up to 80% may get it. But few are truly endangered, and we know who they are. Realize the time frame that we're expecting, make peace with it, and find a way to help each other through this situation, because it's hard for everyone. And the goal for me, socially distanced, but spiritually connected. How do you achieve socially distanced, but spiritually connected? I don't have the answer, but I know the question. Questions, comments?
We're talking about how many testing we're doing, but at the same time, New York City officials told medical providers to stop testing people who don't require hospitalization because of the shortage. How does that sort of, match up?
Well, look, the number of tests will be a calibration at one point. I believe New York City's actions, Melissa knows better than I, but I believe New York City's actions was more on the availability of gowns and equipment. And that's a situation that we're all struggling with. We just are going to send them a big shipment. But I can see local calibrations that different localities are making or hospitals are making on protocols within their hospitals. But we have to get down this. The bottom line remains, we cannot handle the wave at the high point. The wave has to come down. And that is density control. And New York City, give me a plan, especially for the parks and young people. And that is testing. And we're doing more than any place in the country. But testing, isolation, testing, isolation.
Is the city giving you some sense of what those density controls, particularly?
We haven't gotten the plan yet, Jesse. I said yesterday I wanted a plan in 24 hours. I had a conversation with the mayor. I had a conversation with the city council speaker, Corey Johnson. We talked through a number of things. I said put it on a piece of paper because, in truth, whatever I get from New York City, I then want to do in Westchester, Nassau, Suffolk. I don't want people saying in New York City, well, I'll just get in the car and go to Westchester, or get in the car or go to Nassau. That's why the geographic template has been very important. But I haven't gotten it yet. We had a conversation on parameters, but I actually want a plan on paper.
These would be in addition to the density control measures you already have.
Oh, yes. Oh, yes. This is all in addition. Look, I went there. My density control measures weren't enough. That was clear. You could look at a park in Brooklyn, Manhattan. It almost looked like any Saturday, any sunny Saturday when I went. Jimmy?
Yeah, I'm wondering, to go to Marina's question about testing, there seems to be much more focus downstate than upstate. Why is that occurring? And are there plans to distribute resources? And also, maybe Dr. Zucker, we know the global number of ICU beds, but I have to imagine there's more strain localized downstate. So what are those numbers specifically downstate?
You go where the need is, Jimmy. You follow the science, you follow the numbers, you listen to the data. The majority of our cases are coming out of New York City. So you go where the need is. You go where the numbers are. Dr. Zucker, do you want to?
Sure. Thank you, Governor. So the vast majority of the ICU beds are downstate. It's proportional that most of the a lot of hospital beds are down there. So 2/3 of those are pretty much in the city and the metropolitan area around the city.
What about occupancy?
Well, what we have now is we have, as the governor mentioned, we have about 600 individuals in the ICU, but we have many more ICU beds. But we have to, as the governor said, prepare for the potential for many more patients to come in.
Give me 1 second, Joseph. I don't care upstate, downstate. This is one state, and we're planning for one state. If you get overloaded in Albany, then I'm going to use the hospital beds in Utica. If I get overloaded in Buffalo, I'm going to use the hospital beds in Rochester. If I get overloaded in New York City, I'm going to use the hospital beds upstate. There is no upstate, downstate here. It's one state. I'm sorry.
Well, my question was how many of those ICUs that are currently available to 600 people in them now? You said that you have 3,000 ICUs in total in the state.
Do you know, Dr. Zucker, the current open capacity of ICU beds?
I don't know the exact number, but I haven't spoken to some of the hospital leadership members. There are beds, and they are working to create more ICU beds because you can actually turn beds that are a recovery room bed into an ICU bed, and this is what the team that the governor asked the hospital associations to work on, and we'll have a report from them shortly.
A lot of hospital workers are saying that they're being told to go without using a mask or use a scarf. What would you say to them? Is there a resolution to that, or do you think, is there any hope?
Well, I haven't heard the specifics about that, but I know that we have supplies available, and as the governor mentioned in the slide, that we are providing them with more of the protective equipment, both masks as well as gowns.
Let me just say on that. Larry Schwartz has been handling the supplies, finding supplies, with Simonita Subotic, and they've been doing an extraordinary job. Kara's going to join their team. There is no one in this state today who should be able to, who can say legitimately, I can't get a mask. If you cannot get a mask, you saw the numbers we're sending out. We just were successful in getting more, and today we can get masks to anyone who needs them, and gowns. I can't promise you next week or the week thereafter. And that's why I want to see the federal government do this Federal Defense Production Act and stop this ad hoc voluntarism. But today, there is no one who we can't cover. Pardon the pun with the mask.
Governor, have there been any additional measures to limit the spread of the virus in state prisons, jails, youth facilities?
We have different policies that we put in place all across the board, mirroring the nursing homes, no visitors, same type of policies in prison facilities and other facilities.
Are you considering issuing clemency for elderly New Yorkers in state prisons?
It's something we're looking at, yes.
Governor, the president said basically that the cure might be worse than the disease itself. Can you comment on that, and especially in light of you saying that we need to start to look at restarting the economy after this?
Yeah, look, you have to walk and chew gum in life. I don't have the luxury, no executive really has the luxury of being one-dimensional. I'm very proud of the measures we've taken to address this public health crisis. You look at our numbers, we've done things that no other state in the country has done. But I'm also very aware that you cannot it is unsustainable to run this state or run this country with the economy closed down, right? We're spending hundreds of millions of dollars. You have people laid off. You have to get the economy up and running. So that has to be planned at the same time. And Steve Cohen and Bill Mulrow are going to do that. There's another complication, which is what Dr. Katz is talking about. Can you have a more refined public health strategy that is also more productive or less destructive to the economy? Could there be a more intelligent public health strategy that is more productive or less destructive for the economy? Meaning, is it smart to put Kara with me? Right? Is it smart to have college kids coming home, kids staying home from school next to their grandmother? Is that a smart public health policy? Shouldn't you have stratified the risk? That's the public health question. And if you stratify the risk, can people start going back to work and you start to restart that economy? So you're doing smart public health policy and smart economic policy. I think there is a line, a dot where those two lines cross. You have to identify it, and that's what we're going to start to work through.
Do you feel it's overkill at this point?
No, I have no second thoughts on actions that I have taken. I would make the same decisions today. I have no second thought on going to zero non-essential workers. We sat here every day, Jesse. We saw that scale ticking up. I turned the valve a little bit. I turned the valve a little bit. I turned the valve a little. Made no difference. I turned the valve off. By the way, it still hasn't brought the rate down low enough. So I have no second thoughts. I'm sure there will be political consequences. I know people are very angry about it. I had a gentleman tell me, there's no way this state will ever reelect you because of what you did. Frankly, I don't even care about that. I did the right thing, and I'm proud of it. At the same time, at one point, you have to open the valve, right? You have to open the valve because that is oxygen for the economy, and this is not sustainable.
Please speak to, it doesn't appear in the two executive orders issued over the weekend that there were specific rules on canceling all gatherings and large gatherings. Can you speak to if those rules are a recommendation, or do you plan on putting those in writing in an executive order?
Yeah, I'm not sure what you're referring to. Do you know what we're...
No, it's a directive. We put it out a couple of days ago. There's no gatherings of any kind, including weddings, parties, birthday parties. It's a directive across the board. If you're saying that there's some confusion about that, I'll ensure that it's in an executive order today, but that was a directive. It's not a recommendation.
You can get married. It's just a very small convenience, which is also very cost effective. It's like an elopement. It's a government policy.
Are we going to the state budget? The Medicaid bill in Congress is still the same. Senator Kruger said that she doesn't think pot sales should be in it. Where does that all stand at this point?
She doesn't think what I'm
She
saying?
doesn't think that pot sales or marijuana sales are going to be part of the budget at this point.
The legislature is going to do their job, just like the executive is going to do their job, which is our way of honoring the heroes in public service today, the police officers, the firefighters, the nurses, the health workers, the food delivery workers, the pharmacy workers, all those people who have to go out and do their job, right? So the legislature will do their job, the executive will do their job. We will pass a budget, and not just a budget. We will pass a budget and address the policy items that we laid out and we discussed, because it's not just about passing a budget and the numbers. There are many policy initiatives that I laid out back in January, and we're going to pursue all of them. The only caveat was, if you have a really complex issue that normally would require weeks of nuanced, detailed negotiation to do it right, that we won't do. Because I don't want to pass any bills that are not really intelligent that I then have to come back and deal with again next year. So if it's a highly complex issue, I get it. And then let's put it off because we don't want to do something sloppy. But otherwise, no. Bail reform has to be done. I want to do legalizing marijuana.
What does bail reform look like then?
What does bail reform look like?
Yeah, what do you want to see change to?
I think, well, you have different positions on bail reform, right? You have the Assembly, you have the Senate, you have my proposal that I did last year, you have people that are very concerned out there, strong opinions on both sides. I just want to see a resolution and progress, and I want to see it in the budget.
The benefit team recommended $2.5 billion worth of cuts. There are people, I know that's a structural thing for the budget, but we're also really strained in the healthcare system now. Can you do that now? Do you agree with those cuts? And are you thinking about any other way to get through this Medicaid issue?
There are different things in there, right? You have many costs in Medicaid that have absolutely nothing to do with anything we are doing now. And you have many parts of Medicaid that have grown exponentially, where frankly there is gross waste. And almost periodically, you have to go to any of these government programs and you have to question every premise. Why are we doing this? Why are we doing this? Why are we doing this? And you will find there are ways to save money. And that's what we're doing here. We have I want to show you videos that the state is running to help communicate to New Yorkers the need to stay home, the need to isolate, because we're trying to get out the message. I've been saying it, and everyone's been saying it, but we have to do a better job communicating, so we're trying a number of other vehicles. So just show them I have to do it. I have to do everything myself.
Hello, this is Robert De Niro. We all need to stay home. We need to stop the spread of this virus, and we can only do it together. Not just to protect ourselves, but to protect others and all the older people you love. Please. I'm watching you.
Hi, everybody. It's Danny DeVito, and I'm asking you from the bottom of my heart, all over the state of New York, stay home. I mean, everybody. I mean, we got this virus, this pandemic, and, young people can get it, and they can transmit it to old people, and the next thing you know, I'm out of there. So Governor Cuomo asked me to ask you, please, do us a favor, all of us, and stay home, not spread this virus around. Thank you. Watch a little TV, why don't you?
One more questions. Go ahead, Jesse.
Can you talk a little bit about how the infrastructure of New York City, people living on top of each other, giant apartment buildings, subways, how that might just be contributing to the spread of coronavirus?
Density controls, density contributes to the spread of the virus. Airborne, sneezing, coughing, and density in that I touched this table. The virus could live here for 2 days. You come tomorrow. I'm gone. You touch that spot. In New York City, all that density, a lot of people are touching a lot of spots, right? Park bench, grocery counter, just picture the city and daily life. And that's why in denser areas, you'll have a higher rate of spread than in more suburban and more rural communities. It's just a function of interaction and proximity. I have to go to the Javits Center. Thank you very much, guys.
So we have been listening to New York Governor Andrew Cuomo give what is basically his daily briefing to the press on what's happening in New York on the coronavirus. So some of the stats here, 25% of all of the testing happening nationwide is happening in New York. New York has now just over 20,000 total cases, and they have about 5,700 new cases. And those numbers continue to increase, of course, as more and more testing is done. Governor Cuomo was asked if he had any second thoughts about some of the strict measures that he's put in place thus far. And he said, I have no second thoughts on the actions I have taken. I would do the same things today. He is calling for density control, specifically in New York City and in parks where we've seen people kind of still congregating and not practicing social distancing. He's also focused on increasing hospital capacity. He is asking hospitals to increase their capacity by 50%. He says they need 110,000 beds. Right now, they only have 50,000. And he says, of course, that means they also need more staff as well. So he says they have been approaching the retired community and asking them for help. Not mandatory, just a request. And of course, PPE, personal protective equipment, still trying to get their hands on as much of that as they can. We're going to take a quick break and we'll be right back.
There are people in this world who are evil.
I was raised in this cop land.
You're not a creep, you're just a mess.
There's a new way to get Boston news anytime you need it.
Here's a look at today's top stories.
CBSN Boston, an on-demand 24/7 local news source.
Welcome to CBSN Boston.
With top stories, breaking news, and weather.
We're following breaking news right now.
That's it.
And exclusive local content from WBZ.
Dr. Malcolm Marshall joins us.
Free and at your fingertips. CBSN Boston. Everything you want in Boston news. Anytime, everywhere. Go to cbsboston.com/CBSN to learn more.
U.S. stock markets opened down this morning, despite the Federal Reserve saying it will take unprecedented measures to calm investors' fears. The announcement follows Wall Street's worst week since 2008, and while concerns over the pandemic hit other major global markets as well. Melissa Armo is the CEO and founder of Stock Swoosh, and she joins us now by phone to talk to us this morning. Melissa, thank you for being with us, and can you explain how the new Federal Reserve measures will work?
Well, the Fed is trying to do everything they can to support really the bond market right now because the bond market has taken a hit as well as the stock market. So I think that some of these measures that the Fed is taking are going to work. But the problem is until we find a way to either a vaccine or a way to curb the outbreak, I'm not sure that any of these things are really going to ultimately solve the problem. But what the Fed came out today is said that they're going to support and give an unlimited, and I think this is what was really powerful in the statement today, an unlimited amount to support mortgage-backed securities. And so before, in the past, they had always put a limit on the amount of support they were going to give. So when they say unlimited amount of support for treasuries and mortgage-backed securities, I think that was what was powerful in the statement. People want to know that the Fed is going to be there. And I think right now banks particularly may be getting nervous that because businesses are not open, they don't have any money coming in, they're trying to support their employees. And also some people are laid off work, of, again, no fault of their own, that banks are going to see a higher default ratio in loans. So the Fed is saying we're here. And the unlimited word was really powerful to do whatever it takes. I mean, that in that wording today was powerful because they're going to attempt to support what right now, everyone's thinking we're going to go into recession. I just don't see how it doesn't happen at this point.
Melissa, which industry stocks are taking the hardest hits?
Well, obviously the airlines, because no one wants to fly. The cruise lines, because people were getting sick on the cruise ships, on the travel. Anything to do with restaurants and anything where people would be going out socializing. A lot of restaurants, for example, in big cities, they have to be open all the time in order to pay their leases, in order to pay their loans. So I think the biggest hit is really anything to do with the restaurant industry or travel, tourism. Now, they're talking about this bailout. They haven't figured out what they're going to pass yet for the stimulus program, but I think part of it is going to be a way, some type of stimulus to be able to help support some of these other industries. How much, what that's going to be, when it's going to pass, nobody knows. The market initially this morning was down a lot. Then we had a big rally when the Fed came out with this news, and then we collapsed and opened then lower. That was a very, very bad sign. I think the sooner that Congress passes something, some kind of stimulus, the better. The problem is that what's it going to be, and is it going to be enough for this market to get back on track? Because right now the market's broken, and every day people get up, and any amount of red that they see in the day, people are getting scared. They're selling out of their retirement, and they're selling their stock positions.
Melissa, you touched on this here. You said you don't see how a recession doesn't happen. So what would that look like, and if when?
Gosh, it's just so hard to say. I mean, if you had asked me this, 6 weeks ago, I never thought it would get to this point. And I think it's take it day by day. And again, as far as investors go, you really have to try, and also on a personal note, you can't be in fear about what's going on. Take care of yourself, take care of your family, listen to what the government's saying about the stay-at-home orders. But as far as your investments go, I just hate to say people bailing out of all the retirement money if the market's eventually going to come back. The problem is to time when the market's going to come back is very difficult at this point because, again, we didn't know this was going to happen at all this year. We didn't know how long it was going to go on. So it's really hard to say when it's going to stop. Investors continue to want to keep buying bottoms in this market. Like right now, today, if we rally, if we go green, investors will come in and buy, but we could be lower again tomorrow. We could be lower the next day. And so it's really hard to time here exactly when we're going to stop drifting off. I think that it could go on pretty much into the summer as far as the selling goes, although it may not be as bad as it seems in the last 2 weeks. I think that the market is going to probably not get back up to the highs anytime soon, if at all, in 2020. And so that's difficult for people to accept. But if you have retirement money invested and you're not in retirement, then I say hold through this, because what you don't want to do is sell, and then you have realized losses if you're down when you sell out of a position. Those losses then become real. Right now, if you're in stuff and they're down, the losses aren't realized. And so people have to kind of hang on if they want to look at it as a long-term viewpoint.
Melissa, last week we saw a huge increase in jobless claims, and analysts are expecting an even bigger jump this week. So what impact are the unemployment numbers having on the markets?
I definitely think that's one of the reasons we sold off on Friday. We sold off Friday because the numbers were higher than expected. You're probably going to continue to see that again this week. And again, that's why I'm saying here, even if we rally today, we could sell off by the end of the week. Each time those numbers come out, they're going to look worse and worse and worse, because remember, the numbers are retroactive. So all of this that's been happening with the layoffs, we're only 1 week into the period where the administration said the 15-day stay-at-home order. So we're going to continue to see that rise, at least until they have some kind of stimulus package out. But for now, a lot of people are out of work, and it's not their fault.
Okay, Melissa Armo of Stock Swoosh, thank you so much for chatting with us this morning.
Thanks for having me.
You're watching CBSN. I'm Brianna Pitts. We'll be right back with the very latest on this outbreak here in Massachusetts and around the world.
There are people in this world who are evil.
I was raised in this cop land.
You're not a creep, you're just a mess.
There's a new way to get Boston news anytime you need it.
Here's a look at today's top stories.
CBSN Boston. an on-demand 24/7 local news source.
Welcome to CBSN Boston.
With top stories, breaking news, and weather.
We're following breaking news right now.
That's it.
And exclusive local content from WBZ.
Dr. Malcolm Marshall joins us.
Free and at your fingertips. CBSN Boston. Everything you want in Boston news. Anytime, everywhere. Go to cbsboston.com/CBSN to learn more.
This is CBSN.
Thanks for joining us. I'm Brianna Pitts. A reminder to our CBSN viewers around the world, you're watching CBSN Boston because our New York headquarters are closed after several employees tested positive for coronavirus. And now to the very latest. The Senate may try again to pass a nearly $2 trillion stimulus package today. Over the weekend, Democrats objected to a version which they say did little to protect workers and too much to help corporations and the rich. President Trump has now approved a major disaster declarations for New York, California, and Washington state to respond to the coronavirus pandemic. 8 states have now ordered people to stay home to help slow the spread, and this applies to more than 100 million people, or nearly 1 in 3 Americans. Starting today, all daycare centers in Massachusetts are now closed. The only exception, emergency centers will be open for people who must work during this crisis. This includes hospital and healthcare workers, emergency personnel, and grocery store employees. Still, the governor says these sites should be used under a last resort basis. President Trump's decision to approve disaster declarations for New York, California, and Washington state could mean thousands of extra hospital beds, but he's been reluctant to take some other steps when it comes to the federal response. Paula Reed is at the White House.
In a tweet last night, the president suggested that the current restrictions could be revisited as early as next week at the end of that 15-day period established by the administration. The president has really been focused on trying to give people hope, even when that flies in the face of the best guidance from his medical experts. And last night he tweeted, "We cannot allow the cure to be worse than the problem itself."
I'm a wartime president. This is a war.
As state governors increasingly call for more aggressive action from the White House, President Trump has announced he has activated the National Guard in states hit hardest by the outbreak.
Today I'm announcing action to help New York, California, and Washington ensure that the National Guard can effectively respond to this crisis.
Governors will have leeway to use the National Guard as they see fit and could include assistance for medical facilities, healthcare professionals, and even law enforcement. But the president continued to send conflicting messages on using the Defense Production Act, which empowers the federal government to mobilize the private sector to increase the production of goods. State leaders like Governor Andrew Cuomo have asked the president to employ the act.
I think the federal government should order factories to manufacture masks, gowns, ventilators, the essential medical equipment that's going to make the difference between life and death.
And while the president signed it just last week,
we'll be invoking the Defense Production Act.
He says he doesn't actually want to use it.
The concept of nationalizing our business is not a good concept.
The administration says that companies have stepped up voluntarily, but some governors in especially hard-hit states like Illinois are calling for a uniform approach.
This should have been a coordinated effort by the federal government.
The president insists this is not a one-size-fits-all situation.
Every state's different. I mean, Idaho, West Virginia, Iowa, Nebraska are much different than New York, than California.
The president could not say when the U.S. will be back open for business, but today, Vice President Mike Pence said the White House will be issuing new guidance that could allow some workers who have been exposed to the virus to return to work more quickly by wearing masks for a period of time.
The death toll from the pandemic continues to soar in Europe, where Italy faces the biggest challenge. Elizabeth Palmer reports from London.
For Italian doctors and nurses, this has become a marathon of effort and determination. The lockdown is strict. Big cities have never looked so empty. And yet more people are dying of coronavirus in Italy than anywhere else on Earth. But there is a gleam of good news. The rate of infection is definitely slowing, and the number of deaths over the weekend dropped quite sharply. Spain has the second largest outbreak in Europe. The government is extending the state of emergency for 2 more weeks. Here in Britain, though people can go out and about freely, the Prime Minister had a warning.
Don't think that fresh air in itself automatically provides some immunity. You have to stay 2 meters apart.
In most countries but China, the coronavirus is still spreading. But in Wuhan, where this all began, restrictions are starting to be lifted, and life is slowly returning to normal. There have been no new cases for the 4th day running. For CBS This Morning, I'm Elizabeth Palmer in London.
You're watching CBSN. I'm Brianna Pitts. We'll be right back with the very latest on this outbreak here in Massachusetts and around the world.
There are people in this world who are evil.
I was raised in this cop land.
You're not a creep, you're just a mess.
There's a new way to get Boston news anytime you need it.
Here's a look at today's top stories.
CBSN Boston, an on-demand 24/7 local news source.
Welcome to CBSN Boston.
With top stories, breaking news, and weather.
We're following breaking news right now.
That's it.
And exclusive local content from WBZ.
Dr. Malcolm Marshall joins us.
Free and at your fingertips. CBSN Boston. Everything you want in Boston news, anytime, everywhere. Go to cbsboston.com/CBSN to learn more.
The first city to be locked down because of the coronavirus is letting some people head back to work today. Residents in Wuhan who have been in lockdown since January can return to work if they clear a health check. Some checkpoints are also coming down, and public transportation is resuming. Nigeria is ramping up efforts to contain the spread of the coronavirus in Africa's most populated country. International flights are restricted at all airports effective today. The bans come as the country confirms its first death from the virus, and confirmed cases spiked to at least 35. Some grocery stores are taking extra precautions to help keep employees safe. Plexiglass dividers are going up at checkout lanes at Shaw's and Star Market locations. The idea is to ensure a safe distance between cashiers and customers. Thousands of stores will be adding them over the next 2 weeks. Some supermarkets are giving employees a boost for working during the crisis. Stop & Shop announced that it's upping the hourly rate of employees by 10%. Chain is also providing an extra 2 weeks of paid leave to any union worker who contracts the virus. Shaw's and Star Market are also boosting employees' pay by $2 an hour. Well, if you're looking for something to do with your kids today, CBS News' Steve Hartman is taking his On the Road segment online. Hartman will teach a 30-minute class called Kindness 101. It will showcase some of his stories about kindness and the lessons they can teach us all. Those classes go live at 2 p.m. Monday through Thursday on the CBS Evening News page on Facebook. You're watching CBSN. I'm Brianna Pitts. We'll have the latest on the coronavirus outbreak when we come back.
There are people in this world who are evil.
I was raised in this cop land.
You're not a creep, you're just a mess.
There's a new way to get Boston news anytime you need it.
Here's a look at today's top stories.
CBSN Boston, an on-demand 24/7 local news source.
Welcome to CBSN Boston.
With top stories, breaking news, and weather.
We're following breaking news right now.
That's it.
And exclusive local content from WBZ.
Dr. Malcolm Marshall joins us.
Free and at your fingertips. CBSN Boston. Everything you want in Boston news, anytime, everywhere. Go to cbsboston.com/CBSN to learn more.
Live from the Channel 4 studios in Boston, WBZ News at noon starts now with breaking news.
Governor Charlie Baker orders all non-essential businesses in Massachusetts to shut down beginning tomorrow. The governor is also asking for a stay-at-home advisory, asking residents to stay at home as much as possible and to limit all outdoor activities. The governor says these steps are necessary to try to contain the spread of the coronavirus. Good afternoon, everybody. I'm Paula Eben. The governor's order comes after 5 people died in Massachusetts from the virus. The state's Department of Public Health says that there are now 646 confirmed cases in the state, with 121 new cases reported just yesterday. And the number of positive cases is expected to go up as increased testing identifies more patients. The governor wants all of us to restrict all unnecessary activities. WBZ's Christina Hager has the details right now, live from the State House. Christina?
Well, Paula, this move from Governor Charlie Baker stops short of a mandatory shelter-in-place order. No non-essential businesses are open starting tomorrow, and this goes on through April 7th. And the Department of Public Health has also put a stay-at-home order in place. So we are all but in shutdown mode at this point. It certainly comes close. What is considered essential, people are wondering? Well, we have specifics on the WBZ website. So does the state, but it comes down to businesses that provide food, medicine, utilities, and transportation. Everything else is shut down. Although companies can continue doing business online, they are not barred from doing that.
There's been a lot of talk about a government mandating people shelter in their homes. I do not believe I can or should order U.S. citizens to be confined to their homes for days on end. It doesn't make sense from a public health point of view, and it's not realistic, especially if people need to get to work at essential businesses or go to places like grocery stores, pharmacies, or hospitals or healthcare providers.
Now, as far as going outside, the governor talked about that, and perhaps this is where we differentiate ourselves in Massachusetts from a shelter-in-place order. The governor said people should feel free to go outside, go to public parks to exercise and get some fresh air, but don't do things like touch football or pick up basketball games or anything that involves contact or coming too close to others. He said he will be leaving this up to cities and towns to deal with enforcement. And by the way, a lot of people out there are wondering how this affects alcohol and cannabis. The governor did say that liquor stores fall under food and beverage, so they will stay open for now. As far as marijuana, medical marijuana will still be available, but recreational marijuana is out. At the State House, Christina Hager, WBZ News.
Christina, thanks. Massachusetts is now the 9th state to tell non-essential businesses to shut down, but the first state in New England to do so. And Nantucket issued its own stay-at-home order after the island reported its first case of the coronavirus. That order begins today at 5 p.m. and will stay in place for a week. Nantucket Cottage Hospital does not have an intensive care unit, and Provincetown's Board of Health declared a shelter-in-place order after announcing its first 2 confirmed cases. Both of those places are asking people who have second homes there to please stay away. This is the first day that daycare centers across the Commonwealth are closed. Some sites are open for the children of essential workers, but as WBZ's Lisa Greshy found out, many parents are scrambling to find ways to take care of their children.
Daycare centers like this KinderCare officially closed starting today, and now emergency centers for the children of essential workers only will open.
In the basement, my wife is taking a call with her laptop on the ironing board, and the kids are playing.
Introducing the new normal for families across Massachusetts. The Agarwal family taking one day at a time with a 5-year-old and baby at home.
Definitely not easy, working and looking after the kids, and it's like 2 parallel home offices and a household, all under one roof.
The emergency daycare centers are for the children of those on the front lines of combating the COVID-19 outbreak and have to work. The YMCA of Greater Boston has several locations on the list.
Our position is that we want to be there for those families.
Anant and Rupam are both engineers. With daycare off the table, they have no choice but to get creative.
I try to, give my daughter an activity, put my son to sleep, and then go into a meeting.
And explaining the situation to their 5-year-old daughter, Samvi, hasn't been easy.
It's just hard to keep a 5-year-old engaged without their friends and daycare.
As confusing and surreal as these times are, both parents look to their 5-month-old Pranay for a bit of comic relief.
The good thing about this is this guy doesn't care what's going on in the world right now. He's just, having a good time at home with his parents.
As for the emergency centers, hundreds have now opened across the Commonwealth to ensure all families in need have access. Because right now, there will be a lot of people who can't work from home.
And we want to provide their children with the kind of care and services that they need.
Now the governor says these emergency centers should still only be used as a last resort option. All locations will have to operate under a very strict set of guidelines and safety regulations from the Department of Public Health. Reporting in Boston, Lisa Greshy, WBZ News.
Beginning today, the Archdiocese of Boston is suspending funeral masses. Cardinal Sean O'Malley's office recommends that mourners hold a graveside service and a memorial mass will be offered once the crisis passes. Baptisms and weddings are still allowed, but the Archdiocese is limiting attendance to 25 people in accordance with the governor's emergency order. A surge in infections has caused a critical shortage of medical supplies around the world. Medical centers are pleading for help. WBZ's Anna Myler found one family trying to answer the call.
Nurses and doctors are on the front lines